I think I probably just peaked, so I should sit down. Donna, thank you so much, and Secretary Principi, thank you. It is such an honor. I mean, I have to gather myself because I'm a little bit embarrassed and touched by Donna. And I'll talk a little bit more about that in a second. But it is such an honor and a pleasure to be here with you all, more than I can say. So thank you. Thank you for all being here. I have two disclaimers before I launch into my conversation with you. One you already heard, and I hope you'll forgive me, but I am a physician. And I say that because, it's so many of these concepts and ways of being and caring for and with patients is it's the foundation of nursing and many other healthcare professions, and it always has been. So I'm sure it's so now the doctor gets it, so it's a big idea, right? So I just want to say that I get that. I do get that. I really get that. And I'm really a nurse at heart. I truly am. The other disclaimer is that I'm an OBGYN, so particularly my apologies to the men in the room. Most of my clinical examples are female reproductive in nature. So if you have a little problem with that, I just want to give you a fair warning. Okay. And you guys are really lively I always hate being the one between you and the reception and the wine, so I appreciate everyone being so engaged. It's a good thing. Okay, so if you've heard me talk, you may have seen this slide before. This is my one favorite slide. And I'll take a moment. I may take a lot of moments with this because if I don't get to anything else, that's fine. This is not a slide that I wrote. It's the Institute of Alternative Futures, their paradigm. And it is their paradigm, and I'm going to take a little moment and talk to you about this. It's their paradigm for organizational change. And I was at a meeting with VA and DOD and some other folks, and they were talking to us about how do you drive large-scale transformation and organizational change. And their teaching was that if you look to the right side of this slide, that most organizations address the need to change by starting at the bottom right. So they have a circumstance that they don't like. They have a circumstance they want to change. And from that circumstance that they don't like and they want to change drives their behaviors. And you can see, does anyone, at least in the VA, feel like that little rat right now? I do. So drives the behaviors, and you can imagine very often it ends up feeling not in a good place and actually not changing much at all. So they were teaching us about if you really want to lead change in your organization, you have to start with the aspiration of the organization. You have to start by understanding who is that organization? What do they want to be? What really matters to them as an organization? And let that aspiration drive the behaviors of the organization, which then produces the circumstances. So this is me in the back of the room. Happy dance, happy dance. And I'm like, pick me. And they're like, Tracy, did you have something you wanted to say? I said, this is the best capture of what I think the transformation of healthcare is about in this nation. And let's take a minute and look at this, right? So again, I am truly speaking from a medical paradigm. So as a physician, even though I thought I was a very holistic and caring and compassionate physician, I was still trained to start with the circumstance, right? What's the top thing at my progress note? The first thing I have to fill out when a patient comes in, chief complaint. So you don't think that we start with the circumstance? By definition, chief complaint. And then you go from there and you create a problem list, right? And the problem list is just a list of medical issues that I then create a treatment plan for the problem. And very rarely is the person involved at all, right? So it's also interesting to me, there's a lot, if you look at the language that we use in our medical paradigm, in our medical model, it becomes very clear. Of course, everyone used to refer to, except now they know it's not the cool thing, you have to be patient-centered, so now we have to actually use patients' names instead of the diagnosis for the room. The gallbladder in, room 6, right? I used to tease the residents at Duke, I love teaching. And the residents at Duke, and I'm sure this is just symbolic of everywhere, would refer to the clinic they were going to by the body part. I'm not kidding you. I'm going to breast clinic. You're going to breast clinic. Is the whole patient showing up or just the breasts? And they'd look at me like, well, I mean, I'm dealing with just the breasts, you know. And actually, if the patient could sit quietly in the corner and I could just dialogue with a diseased body part, it would be so much more efficient, right? And I'm making jokes, but you guys know it's true, right? This is the paradigm, right? The funniest one, and I can never get this one out of my head, is they go to cervix clinic. Now remember, OBGYN, we're not talking cervix, we're talking cervix. And I'm like, okay, cervix clinic. So what this is women who have abnormal pap smears. But they really just want to deal with the cervix, you know? And honestly, it is the paradigm. It's the way I was trained. And again, the nursing and other professions are trained in much more holistic models. But the fact of the matter is that has not been the dominant paradigm in healthcare in this country. It has not been. It's been, you know, submissive to the dominant paradigm, which is the medical paradigm. You know, now we'll talk about where this gets us and how this turns out, but you guys already know that, right? So the one thing I wanted to say is one of my favorite quotes, and I see it in my own life all the time, and I see it in how I try to lead. As is above, so is below. And actually, when I was putting on the slide, I thought, well, I got to figure out who I should accredit that to. So it's actually Hermes. Who knew? Is who gets credited for this. So I never knew a god could get credited for a quote, but go figure. So as is above, so is below. So this concept of if we're going to change an organization, we need to start with the aspiration instead of the circumstance. It is as true at the system level as it is at the personal level. I said to Donna, here's a great example. You know, Donna said, well, I'm getting to introduce you, so I would like to talk to you. Could we have some time to talk? So we set up some time to talk, and she asked me these stories. And I said, you know, Donna, I have to tell you, and this is so true. I said, no one has ever asked to talk to me, the person, before introducing me. Really? And I thought, well, that's modeling this whole person-centered approach. Let's start with who you are first. What a novel idea. It is a very different way of being. So I want you to keep this in mind as we go through our time together. As is above, so is below, because I'm going to apply this back to you guys. So let's come back to this. So I had my little aha moment in that meeting and got all excited and said what I did about the transformation of healthcare. And 3 months later, I was at a different meeting, and a woman came up and introduced herself to me. And she said, I really want to talk to you because I was at that meeting. Do you remember that meeting, you know, with DOD and VA? And she said, and they had that slide. I said, yeah. She said, I was at that meeting. And that day changed my life. And I was like, really? She said, you got up and you talked. I mean, I remember because I was all excited about this slide. And she said, you talked about this concept. And she said, and I went home and I thought, I don't know what my aspiration is. And she said, I have a chronic condition. She said, I have had a chronic condition for decades. And I go to the doctor every 3 weeks, and I have for years. And I'm very compliant. And this, I should tell you like a little, and I have her permission, of course, to share this story. This is an assistant secretary, was an assistant secretary in the VA. So this woman is like driven, like she is like wired. And she said, look, I am compliant. I do what I'm told. I go every 3 weeks. I don't like it, but I do it. She said, but I left there and I started thinking about, well, what do I want my health for? What is my aspiration in this precious life that I have? We don't go around thinking that way, right? Most of us do not. And she said, and I gave it some thought, and I kept working it and thinking about it. And she said, you know, and this gives you a little insight into how driven she is. She said, you know, I gave some thought to it, and I decided I'm going to turn 50 in 2 years. And before I'm 50, I want to climb Mount Kilimanjaro. I was like, whoa. Like, that would have been my goal. But how amazing is that? She said, so the next time I went in to see my physician, he gets out my labs, says, let's talk about your labs. And I said, no. And he said, excuse me? Let's talk about your labs. That's what we do. We talk about your labs, and then she said, no, I don't want to talk about my labs. I want to talk about how you can help me get to the top of Mount Kilimanjaro. And give credit to this guy, right? Credit and kudos to the doc, who at first is like, what? She's like, no, I'm serious. This is my aspiration. I want to do this. I need you to help me to be able to do this. So she said from that point on, she said, I cannot wait to go to my doctor's appointments. I love them. She said, the other thing is, and she's like this, right? She said, he kept telling me for years that stress played a role in my condition. For years, he told me I should do some stress reduction techniques. For years, I told him, I am not going to sit and do nothing. I'm a doer. She said, guess what I do now? I meditate an hour every day. Now, why does she do that, you guys? She doesn't do that so that she can get better labs. She does it because of her aspiration, right? She does it because now it's not about her condition, it's about her life and what matters to her. And oh, by the way, her condition's better than it's ever been, right? So you start to see this, right? So I was talking to a veteran who'd been treated very successfully for the first time in 30 years for his PTSD. And I said, what's different in your life now that this is in a state it's never been, and what matters most to you? And you know what he said? He said, he stopped and he thought about it, because again, we don't walk around thinking these thoughts, right? He stopped and he thought about it, and he said, you know, for the first time in 15 years, I can watch a sunset and enjoy it. You know, like, right? That's amazing. And how different it would be if we as healthcare teams and communities helped people discover, well, what is it that really matters to you? And let's align behind that. Let's drive that forward. That would be a different kind of a world, right? 2 other quick stories about that. Well, maybe one. I love the VA. And I love the VA, and I came to the VA because I've never been in any organization with as many talented and innovative people ever. And yeah, right? It's true. It's very, very true. So I get this job of kind of putting some words and elevating the work that's been going on a long time in the VA and other organizations too. But I love to go, and when I'm visiting sites and stuff, ask, like, give me, you know, what have you discovered? What's different? You know, how is it for you? And the interesting thing is that and one woman, I think I was in Salt Lake, I can't remember, a nurse said, well, I had this experience where there was this patient, a patient of ours who has pretty severe bipolar disease, comes in and out of the hospital depending on how stable he is. And she said there was this one time he was admitted and he kept escaping. He kept like leaving the hospital and nobody knew where he'd be, and they'd find him, somebody in the community would find him and bring him back, and we'd do our thing and we'd try to treat him and he'd run away again. And she said, I finally went up to him and I just sat with him. And she said, just talk to me about who you are and what's important to you right now. And he disclosed to her that his father had just recently died, and that he grew up and spent a lot of time with his dad in this little cabin somewhere out in the boonies, and he was desperately wanting to spend time back in that cabin. And that's why he kept running away. And nobody on the healthcare team knew that. And it wasn't because they were not caring, compassionate people. It's because we were doing what we were designed to do, what we're wired to do as a system. Treat the disease, the bipolar disease, medicate it, treat it, manage it, get the symptoms better, and we're missing the person. Over and over and over, we're missing the person. This is my thought of this, that modern medicine, and again, the biomedical physician model, modern medicine starts with the body rather than the soul, the mind rather than the heart. But the soul and the heart are the doorways to the healing and the health of the body and the mind. We see it over and over and over again. So what this is about to me, the work in the VA and the partnership with Get Well Network, is the opportunity now to design for that approach and lead the way. That's what this is about. So how do we change the conversation? One of my blessings of being a physician is, you get to be with people in those healthcare crises. Moments when the only other moments I've seen that are parallel to that are moments around birth and moments around death. But these are the moments where suddenly you stop and think, what is this life about, right? It's the moments where people turn to God, whatever that is for them. And many, many of my cancer patients have said to me, my cancer, as much as I didn't like the diagnosis, the treatment, it was the greatest blessing of my life, right? Because I stopped and I reflected and I thought about what matters to me, really matters to me. And I changed my life around that, whether my life has weeks or days or years or decades. And so I've been obsessed with how can we help each other have that kind of aha moment without having the disease, right? Let's not wait till the heart attack or the cancer diagnosis or, how can we do that? It's about changing the conversation. It's about stopping and reflecting on what really matters. So I would like to invite you, my as is above, so is below. Part of that is we can't change what happens in our healthcare systems if we don't change what happens in our own lives, right? We can't change the way we relate to patients if we don't change how we relate to each other. And I would invite you to spend these 3 days with all these amazing like-minded people practicing relating in a very human, real way, because it's a gift to be able to do that. And this is a great group of people to do that. So I would invite you, if you're comfortable with that, to just take a moment. And if you're comfortable with just if you have things in your lap, that's fine. But it's usually easier to listen to your heart and your soul if your body is comfortable. So you may want to put something down if you're holding it. You may want to put both feet on the floor. Close your eyes if you're comfortable with that. And just take a few slow, deep breaths. And then take a moment and just begin the reflection of what really matters to you. And the first thing that comes to mind may be something pretty obvious, like family or loved ones, and that's all fine and good. But I would ask you to go a little deeper. What about that thing that first came to mind do you care most about? What is it that gives you a sense of meaning, a sense of purpose? What gives you a sense of joy? And it may be something that you experienced recently, or it may be something you haven't experienced for a very long time. Either way is totally fine. Just allowing yourself the space to reflect on what really matters to you. When you're comfortable, you can return your attention to the room. And this isn't something that you have clarity around in a few moments. So it's just a beginning conversation. The first person that introduced me to the language of what really matters, is actually Don Berwick. And we were at a meeting at the IOM. And Don Berwick told a story of his own health, and he had a knee issue. And he needed surgery. And he's a physician, so he didn't want to have surgery. Because if you're smart, you don't want to go under the knife. So he's like, so I started reflecting on, well, why am I doing this? Like, really, why am I having this surgery? It's not life-threatening, So what's going on here? Why am I having the surgery? And he said, the first thing that came to my mind was, well, I'm in pain, and nobody wants to be in pain. I don't want to be in pain. I'm having the surgery because I don't want to be in pain. That's what matters to me. Being pain-free is what matters to me. He said, okay, so then I said to myself, part of the reason I like this story is I have conversations with myself all the time. So I like it when other people, share that they have conversations with themselves. So he said, so I thought to myself, yeah, that's true, but what really matters to me? It matters to me to be pain-free, but what really matters to me? And he said, and I thought, well, I want to be mobile. I don't like being restricted, and the pain and the knee issue means I can't get around like I want to, and I don't like that. And he said, yep, that's true. Thought to himself, yeah, that's true, that's true. He said, but what really, really matters? And he thought about that. He says, what really, really matters? He says, I love to skate ski. Which is a kind of cross-country skiing. It's the kind that goes like that, It's hard to do. He said, I'm not particularly athletic. It took me a long time to learn how to do this. He said, but I love to skate ski. And I don't really want to live life, if I don't have to, without being able to skate ski. So he said, well, I thought to myself, yep, that's right. That really, really matters to me. And then he said, what really, really, really matters? And he describes this scene. He says, I skate, when I can skate ski, I go to this place, and and he paints this picture of where this place, every year he skis out in Colorado, I think it was, and there's these aspens, and he says, and this amazing red squirrel always shows up. Like every year that red squirrel shows up. And he said, and I just soak it in, and I'm in this beautiful place. He said, that really, really, really matters to me. And I love that. And I thought, we don't think this way. And we're so busy in our lives doing, that it takes the healthcare crisis, or it takes the death of a family member, or it takes some really disruptive thing. Let's not wait, you guys. So I would encourage you these next 3 days to continue to reflect on what really, really matters. What do you want your health for, right? What does it matter? Because I can assure you, you don't want to exercise more, lose weight, reduce your stress, so your LDL is lower. I mean, do we really? Really? Let's think about that. No, it's not. That's why we're failing in this country with our healthcare efforts. So I like this, right? You don't have a soul. You are a soul. You have a body. I love that. I so love that. And so let's connect with our souls. And then our bodies are like, okay, I'll sign up for that. I want to be healthy for that. That's a good thing, right? So what about the VA and all of this? Well, I love the VHA mission. This is verbatim what it is. Honor America's veterans by providing exceptional health care that, what? Treats the disease? The body part? Oh no, look at that. That improves health and well-being. That's the language. That's our mission statement. It has been, I don't know for how long I should figure that out. But I looked at this, I went, this is awesome. Now, here's the tricky part. We, like the rest of American medicine, are not designed to do this. And I will say the VA is more designed to do this than any other healthcare system because we care for the whole patient. But as a system, we're still a medical model, right? I mean, take little examples like the system is set up, benefits. I got the chance to interview General Casey at one point, and he said, we don't have a disability, we have a disability system. We don't have an ability system. We reward disability. And we have veterans now who are doing this whole health approach. They're getting better, their conditions are getting better, and guess what? Their benefits check goes down. I mean, that's a disincentive, right? We give them travel pay to come for their medical appointments, to do things for problems, but we don't give them travel pay to come and learn health-promoting behaviors. See, and again, this is not a criticism. This is the system that we're in, the medical paradigm that we're in. So it is now time for us as a system and as a nation to say, how do you hardwire for this? How do you make this massive transformation? And that is why I am like the #1 fan of Get Well Network. And we now have, I had to look it up, 37 VA facilities that have Get Well Network in our health systems and in our hospitals. And part of my passion for it is from where I sit, this is a huge opportunity to begin to do this. And it starts with the inpatient side. I mean, how many of you all have either been an inpatient or have had a loved one who's been an inpatient? I mean, probably, I can't see any of you. Are you out there, by the way? No, that's good. Laugh once in a while, so I'm like, okay, they're still there. I mean, all of us, right? I mean, my funny little example, I gave a whole little discourse to the Get Well Network team about my ex-husband and all that, and I promised I wouldn't go there today. But maybe over the cocktails in the reception area, we could talk about that. But there's this mind-body connection, right? So all I'm going to say is I was in this not very healthy relationship where I decided the best way for me to survive the relationship was never to speak my truth. So lo and behold, like I kept saying to the counselor, I'm going to get sick. If I stay and this is unhealthy, I'm going to get sick. So one day I end up with this mass in my throat. I'm not making this up. And so I have to have surgery. It's a long story. And so I'm into integrated medicine and I do all this holistic stuff, and it was a great experience, actually. But the day of the surgery, so now, mind you, I've like have this massive, incision, and they had to detach my tongue and all these really gross things. And so then they said, it'll probably take you months to relearn how to speak and swallow. And of course, I said to the ENT surgeon, excuse me? He says, well, a couple months. I said, but you don't understand. That's what I do. I speak and I swallow. Like, that's it. That's like my repertoire. He's like, no, it's fine, it's fine. So I am lying in the hospital bed one day, the day of my surgery. Of course, my then husband had gone on home to get some rest because he was really tired from this experience. And I was lying in the bed, and I needed something. I don't remember what I needed. It wasn't pain management, though, because I had done hypnosis and acupuncture. I had no pain, none, which is a whole other story. But I needed something, so I hit the buzzer. I told Michael and his team this. I hit the buzzer, and the guy comes on the intercom and says, can I help you? And I'm like, I have a drain coming out. It's sitting in this little pocket in the top of my gown. I'm like, really? So he hangs up. So I buzz the thing again. I'm like, after a few times, I'm sure he's going to get the message, right? Can I help you? Now he's mad at me. Can I help you? And I almost hear him go, ugh, and hangs up again. Third time, finally, I just stopped. And it's kind of like the broken finger story, which really it was the event that made me say, maybe I should go into medicine. It was like, wow, that was just, I was recovering from a surgery. It wasn't life-threatening. It wasn't horrible. But how disempowering, how frightening, right? And so think of what you all have done and Get Well Network has done to put the patient and their family back in the center of that inpatient experience when they are so scared and so vulnerable. And the systems are, as they are not designed to do that. And that is rewiring the entire experience. And I am so thrilled that we are working with you guys in doing that. And of course, it doesn't stop there. So we're saying, wow, okay, how can we continue to use and hardwire these kinds of questions about what do you want your health for? What really, really, really matters? And then let's look at your own well-being and design for that. And that's the work that we're getting to do with Get Well Network that I'm so thrilled about, so thrilled about. So the way we're conceiving of this in the VA, and many of you are doing this work in lots of different forms, and pretty much a lot of it is in paper right now, but that's changing with Get Well Network's help, that, we're saying, let's start with the veterans' mission, their mission. What matters to them? And, I do want to say one caveat that I have, because it really pushes my buttons. I have had people react like, well, only we educated people would have missions in life. It's like, really? Oh my gosh, really? Like, I want to take that whole Maslow triangle thing, where you don't get, what's the top level? Actualization until you've had all your other needs met, and flip it on its head. Some of the most spiritual, self-actualized people I know are the people in Haiti who have nothing, and 30% of their kids die by age 5. They don't wait till they get their food before they think about, greater things in life. It's quite the opposite. So anyway, that's my little dissertation that for us to think a homeless person, this wouldn't apply to them because they're homeless. It's like, really? If your mission is food and shelter, there is nothing more important than that. So helping veterans take a moment and ourselves to say, well, what is that? What brings me a sense of meaning and purpose? That's what I want my health for. Then creating a comprehensive plan around that. A holistic plan around that. What we discovered actually when we were still at Duke is if you do the first two things, it's good. And you can create a really beautiful personalized health plan, and it's got all the self-care elements, and it's a nice holistic thing. And if you say, good luck with that, let me know how that turns out. A lot doesn't change because behavior and self-care habits are very hard to change. So it takes a lot more than that. It takes training and it takes skill building. And even having the skills now, like to shop differently or eat differently or manage our stress differently or manage the voices in our minds differently, it still takes support because those kinds of things are challenging. So what happens when we share this with our veterans, which we've been doing now for probably 3 years, we've had this kind of approach. The veterans go, well, yeah. If you think about their values and their culture, this is common sense, right? They committed to goals and outcomes of service, their military service, with tremendous self-discipline and self-sacrifice. It is all about mission, right? They wouldn't have served if it weren't for the sake of mission. Plan. Do you think they would have gone to battle if there's no plan? Right? They were counting on people having a plan. Training. Would they have been sent to the theater without skill building and training so they could actually execute on the plan and be successful? Of course not. And support. My father was a World War II veteran. I remember to this day, I can never get past this slide without telling this, because I remember as a kid growing up, going to his squadron reunions, and these men who may not have seen each other for years, but they were in the thick of it in World War II, the bond between these men, unbelievable, right? So these values make perfect sense to the veterans, and we are learning from them, which is a fabulous thing. Veterans committed their lives, their health, their well-being to mission success in defense of our country. And now we can help them be mission ready for their lives. I really love that phrase, mission ready for their lives. Optimizing their health in service of what matters to them. And how will we identify success? When they have success and achieve outcomes that they didn't even know were possible. It wasn't even on their radar screen until they started doing this reflection. And we're seeing that all over the country now. It is so exciting. It is so fabulous. It is so wonderful. I can't even tell you. And now we get to start to hardwire it with Get Well Network. Another quote for reflection. You may have heard this. I love this too. We are not human beings having a spiritual experience. We are spiritual beings having a human experience. And I think one of the greatest joys of being in healthcare is to be present with people in these moments where it is quite clear that this is the truth. My vision, this is just my personal vision, is what would it look like if healthcare really became about, a relationship with healthcare was about beginning with an exploration of what matters to you. What do you want your life for? What do you want your health for? If that was the role of healthcare. And then, of course, to get there, to achieve that, to live that fullest life, we need to address your cholesterol, your pain, your circumstance that's getting in your way. But now, think how motivated you are when it's not about the symptom, the LDL, It's about what really matters. I'll tell one more story that demonstrates this. I'm sorry they're all women patients, but as I said, that's what I do. So this was a woman who, I was actually not her physician, but I was talking to her about this vision. And she said, can I interrupt you? I want to tell you a story. And I said, can you tell I love stories? I love stories. I said, sure. She said, I don't know if you know, but I've been struggling with breast cancer. And 3 weeks ago, I was in the ICU on a respirator. And I actually knew this. You know how I knew this? Because I was supposed to meet with her 3 weeks before. And I went to her office, and they said, oh, we're so sorry. She's not here. She's in the ICU. Kind of like that. And I thought, okay, that's not right. She's not a healthcare provider. I said, what do you mean she's in the ICU? Well, she's struggling with breast cancer. She had some complications. She's on a respirator, but she really wants to meet with you. And I said, okay, first of all, that's a problem, right? And I went in to meet her 3 weeks later, and I was sitting there looking at her. I was so glad she said, let me tell you a story, because I couldn't stop thinking. I mean, here she is. She looks fine. She's like sitting here having this conversation with me. She said, I want to tell you something. 3 weeks ago, I was in the hospital, in ICU, on a respirator. And she said, and I was so frustrated because my healthcare team running around, working on me, trying to get me through this crisis, didn't know anything about who I really am. And she said, here's what you need to know about me. She said, this was her language. I think this is so interesting. I've talked to her since she told me the story. She said, I live for my work. That was her language. I live for my work. She said, I love this job. I wanted to get out. And she said, I'm pretty type A. She's like, yeah. She said, and I wanted the most aggressive treatment plan. I wanted everybody on that team knowing I needed to get out of there as fast as possible so I could get back to what I love and what I live for. And she said, and everybody's being touchy-feely and kind. And she said, I couldn't get anybody's attention because she's intubated, not that easy. It's like me with the buzzer. Call back later. Couldn't really get anybody's attention until she got a therapist to notice she wanted to communicate something. And she was able to communicate that she wanted the most aggressive plan possible, 24/7, because she wanted everybody pulling to get her out and to get her back to her job that she loved. And she said, they got it. They turned it around. I did unbelievably well. And she said, the only thing, excuse my language, that pissed me off, she said, was there was this little Indian woman, 80 years old, in the bed next to me, and she got better faster than me. I said, oh, got any competitive issues there? And she said, you know why? You know why she got better faster than me? She said, because her family knew that she loved and lived to eat and cook with them. And every day, her family would bring Indian food in and sit by her bedside. Not because she could eat it, because she couldn't. She was intubated too. But so she could smell and see and remember the joy that she had in this life. So this is what we're about. And what a difference. And then it's kind of like, and oh, by the way, clinical outcomes get better. Oh, by the way, costs go down. Think of all of our chronic conditions. You know why we're so bad with chronic conditions in this country? It's because we treat it like an acute disease. Like I said, whether it's stress or weight or exercise or lipids, these behaviors are painful to change, right? You better have a really strong and sustainable motivation. So this is really critical in the transformation for healthcare. I'm going to close by sharing a video, a very short, I think it's 3 minutes video. What I want you to know a few things about this. First of all, my dear friend, Christy Mack sent it to me. I love Christy Mack. Thank you, Christy. I know you don't even know what I'm going to show. And the thing about this clip is that this is based on a true story. So please know that. That's what's powerful about it. And also know that it's in subtitles, so you're going to have to read the subtitles, okay? So do I say roll the film, or what do I do?
人为什么活着？为了思念，为了活下去，为了活更长， 还是为了离开？
去骑摩托车吧！
5个台湾人，平均年龄81岁，1个重听，1个得了癌症，3个有心脏病，每一个都有退化性关节炎。6个月的准备，环岛13天，1139公里，从北到南，从黑夜到白天，只为了一个简单的理由。人为什么要活着？
So I love that, and I would leave you with the invitation to spend this time, and I particularly relate to my peers in the VA who are feeling really depleted right now. Soak it in, get connected to yourselves, as is above, so is below, to each other, and to the work. So thank you so much. Thanks.